Hi there, my name's Taryn and I go to United Medical Institute in Central Heights, California. Today I'm going to be demonstrating how to scan the aorta, and we're going to be using the curvilinear probe in order to do that, as well as using the abdominal aorta setting on our machine. After putting on our gloves, we're going to grab our curvilinear probe and our gel. We're going to apply our gel to our probe. Of course, our notch is always going to face the screen. We're going to warn our patient about potentially cold gel, and then we go ahead and apply it. First thing we're going to do is we're going to hold our probe in the sagittal plane. We're going to apply it right here, right below the xiphoid process, in order to obtain an image on our screen here that shows the aorta. Once we do that, we also can move down to follow the aorta into the abdomen, where it bifurcate into left and right. Iliac arteries. Once we find our bifurcation in the sagittal image, I'll go ahead and make sure I've got it right there. Go ahead and freeze it. And then of course we save our images. And first I'm going to annotate. I'm going to go ahead and unfreeze my computer because next I'm going to go ahead and do transfers. I'm going to go ahead and delete my annotation. I'm going to place this back onto our patient. And once again, right below the xiphoid process, we're going to look above the pancreas and look for the aorta. Now, this patient, may you please take a deep breath and hold? Great. Now, if you'll see on my screen, I've got a nice round hole here. I'm going to go ahead and pan it back until I get the best image I can, because I will be measuring it. Let's go ahead and stop right about here. We're going to go ahead and measure from anterior to posterior, including the vessel walls. And I'm also going to be paying attention to these values right here. Of course, for the aorta, we're probably going to want a more round aorta than maybe more oval. Then I'll go ahead and label it one more time. We're going to do transverse aorta. This one happened to be proximal. Next I'm going to go ahead and unfreeze once again because we're going to work our way down. We just did proximal. Next we would do mid and then distal at the end. The thing we're looking for is to see if there's any abdominal aneurysm. Of course we don't want that, so that's what we're checking for. If anything's a bit bigger than 5 centimeters is usually a red flag. One of the last things we're going to do is we're going to go ahead and wipe down our probe and do a dry wipe first. And then we're going to get it with our antiseptic spray, cleansing solution. Alright. Sometimes I do just a little bit more. Try to get through the corners and the corner. I go through my keyboard. And we call it a day. Once the scheduled exam is all completed, of course you're going to take your towels and you're going to go ahead and clean off your patient. Make sure all the gel is gone. Ask them if they feel comfortable. Of course you're going to help them up and everything. And once the patient is out of the room, I like to go and then clean my probe and send over the pictures to the reading physician, which will then of course contact the patient with all the answers. We're going to go ahead and clean the bed, reset for our next patient or sonographer. After that, I'll dispose of my gloves in a proper manner, and then we're all done for the day.